My foreskin doesn't pull back at all. If your foreskin doesn't pull back, there's a good chance that you might have something called a phimosis. If you are under 10 years old, this is completely normal. You can get something called a congenital phimosis. So this is normal in boys from birth. But as they get older, the foreskin should separate from the head of the penis and it should be able to retract. It can lead to recurrent infections. It can lead to ballooning when you're peeing. It can lead to discharge and pain and swelling. And if any of that happens, please go and see a doctor. But if you're over the age of 10, then we might start thinking about doing some sort of treatment. So you can have that congenital phimosis, which is where it's been there since birth, and it just hasn't resolved after the age of 10. And then you can also get an acquired phimosis, which usually happens much later in life, and people have been able to retract their foreskins, but now, for some reason, for whatever reason, they're not able to. And it doesn't always have to be a problem, but there are things that we can do to treat it. So particularly in teenagers and young adults, we can give some steroid creams to help reduce that scarring between the head of the penis and the foreskin, and that should hopefully allow it to retract. If that doesn't work, then we can refer to urology, and they might consider doing something like a circumcision or even a partial circumcision, or they can do something called a preputioplasty, which is where they widen the foreskin under local anesthetic. And when they do that, the foreskin should then just be able to retract normally. But with any of these situations, you need to seek some medical advice. And if you're a teenager and you don't want to tell your parents, you can go and see a doctor by yourself. But I would still always try and recommend you to involve your parents because they would probably want to know.